This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.
Aloha, and welcome to the monthly public presentation of the Vegetarian Society of Hawaii. Since 1990, the Vegetarian Society of Hawaii has been following our mission of promoting human health, animal rights, and protection of the environment by means of vegetarian education, as we've grown to become one of the largest all-volunteer nonprofit vegetarian societies in the nation. How many of you are here for the first time? Okay, we got a few. And how many of you are Vegetarian Society of Hawaii members? Yay, good number of you. All right. We'd like to encourage those of you who are not yet members and those of you who are not even vegetarians yet to join the Vegetarian Society tonight. You'll receive an informative newsletter as well as discounts on Oahu, Maui, Kauai, and on the Big Island at many vegan and vegetarian-friendly restaurants, businesses, and groceries, such as at down-to-earth organic and natural stores. Please remember that if you spend just $10 a week in groceries or on eating out, you're going to be saving a good deal of money. By the way, I believe that I forgot previously to mention that and to announce our newest VSH membership discount of 10% at Hawaii Nutrition Company, Herbology Studio at 318 Kamani Street in Kaka'ako, which features herbal supplements and bath and body products made from Hawaii-grown sources. You'll also be supporting, by the way, if you become a member, events such as tonight's, which are not only made possible, but free to the community as well through your membership dues and donations. VSH members and friends can also enjoy popular social activities, such as the delightful one we had last month with Chef Catherine Blake at Simple Joy Vegetarian Cuisine on July 10. At that dine out, 17 diners enjoyed vegan summer rolls and their choices of sizzling Vietnamese pancakes, braised eggplant and tofu with brown rice, noodles and mixed vegetables, as well as some pleasant conversation. And if you missed all that, you know, you can certainly go to the restaurant and enjoy that, although without the rest of us there. I want to welcome Matt Gisa to the board, wherever Matt is, if he's not here tonight. And I'd like to mention thank you to Steve and Catherine Blake, who are stepping down as our VSH Maui coordinators. They did a splendid job. Our new Maui coordinator will be Jerome Kellner, whom they'll be helping for the next few months to get him on his feet and then thank him for taking on so courageously that big job. And a big mahalo to Steve and Catherine for doing theirs so well. It is now time for our special guest. We're delighted to have with us Ankur Jain, MD. A lifelong vegetarian, Ankur Jain, MD, FACG, is a board-certified gastroenterologist and assistant clinical professor of medicine at the University of Hawaii at Manoa, John A. Burns School of Medicine. Dr. Jain, who grew up right here in Hawaii, is a graduate of Punahou School. He received both his Bachelor of Science degree in biology and later his medical degree in 2002 from Northwestern University in Chicago, Illinois. He went on to complete an internal medicine residency at Loma Linda University Medical Center, where he rose to become chief resident, later winning a gastroenterology fellowship at Kaiser Permanente Medical Center in Los Angeles, California. After practicing in Southern California for 4 years, Dr. Jain returned to Hawaii in August 2013 and started a practice with his wife, Dr. Shilpa Jain, also a gastroenterologist, who had recently completed her fellowship at the University of Southern California. It seems that a passion for gastroenterology runs in the family, as Dr. Jain's father, Dr. Amod Jain, is also a practicing gastroenterologist. Thank you. Dr. Ankur Jain has a special interest in colon cancer prevention and has published several papers on colorectal screening. He and Dr. Shilpa Jain are also raising twins, who perhaps are future gastroenterologists themselves. Dr. Jain's presentation tonight is entitled Veganism, What a Body Wants, What a Body Needs. Please join me in welcoming Dr. Ankur Jain.
Well, thank you, Lorraine, for that introduction. It's a pleasure to be here tonight. Good evening to everyone. I am a Hawaii boy. I grew up here in Hawaii, but I did train in the mainland. That's where I was practicing before returning back to Hawaii just almost a little bit more than a year ago. You know, we are a family of GIs, and so time to time I do call on my dad if I have any difficult cases, and actually my wife as well. We kind of go over cases and different discussions, so you can imagine it's a pretty boring dinner conversation from time. But besides being a family of GIs, we're also a family of vegetarians. Both my parents, wife, and kids as well. Kind of a funny story. My kids, who are just turned 4, they're in preschool. About a year or so, they were in their Alua Baptist, and their teacher was passing out some snacks. And one of the snacks was a goldfish. You know, my daughter, Dia, she said, no, we can't eat that. Well, that's fish. Of course, they were just snacks, cheese snacks, but the teacher was very impressed that at such a young age, she was only 3, you know, she still had the concept of being vegetarian and you know, avoiding meat. So today's talk, veganism or vegetarianism, plant-based diet, basically, from a health standpoint. You know, we all know from the ethical standpoint, prevention of cruelty to animals, environmental impact, feeding grains and other substances to livestock, which could be used to feed families, as well as the impact on the environment. But I think equally important, or even more important, is the impact of plant-based foods and avoiding meat on health, our health, particularly as it pertains to the digestive tract and GI and liver conditions, which is my area of specialty. So I did want to go over, during the talk, several myths and misconceptions that do come up from time to time, and focus and arrange my talk, you know, basically discussing each of these myths. Common myth that we hear, or common misconception, are that humans are meant to eat meat. You know, people think that we're the top of the food chain, and we're above animals, above plants, and therefore just naturally we're meant to eat meat. I'll talk about some reasons why that's not the case. Just a patient, in fact, just today, who had heard that we were giving a talk on veganism and health benefits, actually asked me, you know, well, how are you getting your protein in your diet? And that's another common concern or common misconception as well, is that we're not able to get enough protein on plant-based foods, and we'll talk about some ways that can be avoided and we can get protein in our diet. Nutritional deficiencies, that's another big topic. Vitamins, minerals, things that people normally associate with animal-based products can get equally well in plant-based foods, or if needed, some supplementation. And then finally, the main part of the talk is the health benefits. You know, pretty much going from head to toe, talking about different things that are impacted by plant-based foods and can prevent diseases. So again, just briefly talking about human anatomy and physiology as it pertains to humans, as it pertains to herbivores, which are plant-based animals, as well as carnivores. Plant-based sources of protein, vitamins, and minerals, which a lot of these have already been discussed in previous lectures at the Vegetarian Society. So most of my talk is actually going to be on health benefits, particularly on digestive health. The slide may not have come out very well, very small print, but basically this is just giving an overview of our anatomy. Again, starting with our mouth, teeth, saliva, how we initially chew our food, digest it, move it down to the esophagus, which is our food pipe, and the stomach, which is used to grind up the food, digest the food further. And then the food is eventually absorbed, the nutrients are absorbed in the intestines and eliminated in the waste. So let's talk about that first myth. As far as humans being meant to eat meat, humans are in fact much closer to herbivores, plant-eating animals, who lack the physical characteristics of carnivores. And we're not actually well suited for eating meat. So if you do a comparative anatomy of carnivores, or meat-eating animals, and humans, you'll see that humans are much more closely related to herbivores. Carnivores have very large canine teeth, and blade-shaped molars. And these are very essential because these carnivores are actually tearing away flesh, biting down on those animals, and they need those sharp teeth to help them break up this food. Whereas humans, as well as herbivores, much smaller teeth, canine teeth, flat back molars. And the reason for that is we're actually meant to grind up fruits, grind up vegetables. We're not meant to actually tear up that flesh or that meat. Furthermore, jaws in carnivores are actually only designed to move up and down. Whereas in humans, as we know, we can move up and down and side to side. Again, helping us grind, digest those vegetables, those fruits. Not really helpful in just eating meat alone. And then sharp claws, whereas we have much softer, shorter fingernails. So these are the teeth, the jaws, nail structure. And just a brief picture of comparing humans with herbivore, which is the sheep, and omnivore, or dog. You can tell that the jaw structure is much more similar to the herbivore than it is, of course, to the dog. Moving on to salivary stomach acidity. We know that carnivores have very small salivary glands, whereas herbivores, as well as humans, have much larger salivary glands. Why is that? Because we require that saliva to actually digest or break up that food, especially the starch-based products. There's an enzyme in our saliva called ptyalin, which is not present in the saliva of carnivores. And that is an enzyme that particularly helps digest starch. Carnivores don't necessarily need that because they're much more focused on eating animals, eating flesh. And finally, acidity of the stomach. The pH of stomach in carnivores are known to be very, very low, actually less than 1. Whereas this pH of stomach acidity in herbivores and humans are much higher, 4 to 5. We don't need very strong acid to break down the vegetables or the fruits, whereas carnivores are much more reliant on that acid to break up that meat. And then finally, intestinal anatomy. We know from studies that carnivores actually have very short intestinal tracts, both their small intestine as well as their large intestine or colon. Humans, on the other hand, as well as herbivores, have much longer tracts than similar-sized carnivores. Why that's important is because meat, when it actually gets down to the digestive tract, has a lot of bacteria in it. Large intestines, longer tracts are actually going to allow that meat to rot, the bacteria to multiply. It can actually be very dangerous or toxic to the carnivores. Whereas fiber-based material, plants, fruits, they actually require a lot longer intestines, a lot more time to digest. Fiber is always more difficult to digest than a simple meat. And that's why we require these longer intestines. Similarly, alkaline intestines in carnivores, whereas more acidic intestines in herbivores, that's where we're doing most of our digestion, our grinding, and breaking up this material. Again, just a picture comparing humans to carnivores. Our intestines, almost 10 to 11 times our body length. In carnivores, 3 to 6 times. So again, trying to get that meat out as quick as possible. They don't require a lot of digestion. Well, again, a very small slide, but this is actually a very interesting table that was actually created by Dr. Milton Mills. It's called the Comparative Anatomy of Eating. It actually compares side by side carnivores, omnivores, herbivores, and humans. And you can tell similarities between humans and herbivores going down jaws, stomach, intestines, even digestive tract, kidneys even. You can certainly print out a slide of that for you guys to see. But very interesting and actually makes a lot of sense as to why humans are meant to eat vegetables rather than animal-based protein. So moving on, the next myth is we can't get enough protein on a plant-based diet. Again, not true. We know for a fact that some of the world's most famous athletes, some of the strongest warriors actually don't eat meat. They're vegetarian. Just going through a list of some of the most popular ones that we may see in the media. Joe Namath, a famous football player, quarterback. Martina Navratilova, Billie Jean King. They were both vegetarian. Carl Lewis, once considered the fastest man alive, a vegetarian. And Shaolin monks, adept at kung fu fighting, they're vegetarians as well. And not just athletes and not just warriors, but you actually go through a list of entertainers, inventors, ancient times, their history, Mahatma Gandhi, Rosa Parks, inventors including Ben Franklin, Thomas Edison, Da Vinci, these were all vegetarians. As far as protein, plant-based sources of protein. So you'll hear very commonly soy, tofu, soybeans, very good source of protein. Other beans that have protein base in them, navy beans, black beans, pinto beans, as well as a wide variety of lentils. Nuts. Nuts are an excellent source of protein. Almonds, peanuts, pecans, and here in Hawaii, macadamias. And then quinoa seeds. If you guys have ever tried those, very packed with a lot of protein as well. And then fruits. Avocados are a good source of protein. Leafy dark green vegetables, and you'll notice that as a common theme in the next few slides. These are abundant source of protein as well as different vitamins and minerals, and specifically broccoli, cabbage, collard greens. They all provide a very well-balanced source of protein as well as different nutrients. So again, just addressing nutritional deficiencies. Specifically, I'm going to go over iron, B12, calcium, and vitamin D. As these are the ones we most commonly hear about possibly being deficient in plant-based diet. Definitely, it's important to have a well-balanced diet. You know, whether you're eating meat, whether you're not eating meat. Particularly important for people who don't eat meat. And sometimes you may not be able to get enough of these vitamins or minerals, so there's no harm in supplementing them with vitamins. Just keep in mind that some vitamins do have gelatin, so those are made from the cow lining, so you want to obviously avoid those. But as far as iron, the first mineral, this is a mineral. It is very crucial for the production of hemoglobin, which is an oxygen carrier in the body. And people don't have enough iron can become very anemic. Lack of iron can be either because of iron loss, they're losing that iron somewhere through blood or through bleeding. They're not absorbing that iron. There's various different conditions that can cause malabsorption, make it difficult to absorb this iron. And they're just not getting enough iron in. Again, maybe because of their not having a balanced diet. Plant-based sources, though, to consider and keep in mind for supplementing or maintaining iron levels. Fruits and vegetables, particularly apples, watermelon, apricots, they're a very good source of iron. Leafy green vegetables, once again, but spinach, keep in mind that although it is a very high-packed iron vegetable, it actually contains a chemical called oxalate. And this chemical actually forms an insoluble complex with iron, and that makes it actually much more difficult to absorb the iron. So that's why it's recommended not to eat spinach as far as a source of iron. Of course, spinach has other values and other vitamins and minerals that it does contain. And then finally, legumes like beans, lentils, and falafels, some of which we've already discussed before. Iron can be more readily absorbed if we eat foods with vitamin C. So oranges, citrus foods can help increase that absorption of iron. But on the other hand, it actually is inhibited by fiber and fiber components. So again, as I was mentioning, spinach, oxalate, other substances include chocolates, and another actual chemical called phytic acid. This chemical is present in grains, wheat bran, and soy. And these substances can also inhibit the absorption of iron because of complexes that they form in the body. So something, again, just to keep in mind. But vitamin C, always good to supplement as far as absorption of iron. Moving on to B12. So B12 deficiency, B12, which is called cobalamin, is a water-soluble vitamin. Deficiency can also result in anemia, just like iron. But it's also present in the central nervous system and the brain. So it also results in neurologic damage if it's deficient. So interesting point to note is that despite the common myth that animals, if you eat animal products, they'll contain a lot of B12 in it, animals in themselves don't actually produce the B12, and neither do plants. It's actually the bacteria or the fungus that are present in these that have the enzymes required for the synthesis of B12. Really not that many sources of B12 if you're not eating meat, but the ones that are most commonly seen are soy milk and definitely fortified foods. So cereals, yeast have B12 supplementation, and they're a good source. All right, how about calcium? Calcium is very essential to the growth of bones, growth of teeth, and it is a mineral, and its deficiency can lead to osteoporosis, which is decreased bone density. And clinically, we can detect osteoporosis from bone density scans or DEXA scans. And in vegetarians, it's present in lactate or milk, but in strict vegans, there are other sources of calcium as well. And those include fruits, leafy green vegetables once again, tofu and beans, particularly white beans and soybeans, almonds, and then various different seeds. And then once again, you can actually get the calcium that you need in fortified substances, including soy milk and orange juice. A lot of the orange juice that you see in grocery stores will be fortified with calcium. And once again, similar to iron, it is another mineral and can be more readily absorbed with vitamin C. So another reason why drinking orange juice is good, because you already have that orange component that helps increase the absorption of calcium. And similar to iron, it can be inhibited by dietary fiber, spinach, and other substances because of the complexes that it forms. Finally, vitamin D. Vitamin D, once again, very important in growth and remodeling of bone. This deficiency leads to rickets in children, osteomalacia in adults. Once again, not that many sources in plants, but there are a few mushrooms, shiitake mushrooms and yeast, and then fortified foods as well. But the one benefit we have being here in Hawaii is that it is synthesized by the skin. So when there is adequate sunshine, you actually get an extra source of that vitamin D, which is helpful. All right, so the remainder of the talk today is going to be basically looking at the specific health benefits of avoiding meat. And there are multiple. We've heard in previous lectures about various different benefits, including lowering levels of blood pressure, cholesterol, decreased incidence of heart disease, diabetes, arthritis, as well as various cancers, most specifically breast, colon cancer. But again, the focus of my talk today is going to be the prevention of GI and liver disease. And we're going to again just go head to toe. So we'll start off by talking about reflux or acidity, gallstones, fatty liver disease, hepatic encephalopathy or confusion, which is a very serious manifestation or complication of cirrhosis, which is liver failure, diverticulosis, which are basically pockets or weakness in the walls, and then finally colon cancer, which is my particular area of interest. So let's start off by talking about reflux. So we know for a fact that our stomachs have a certain amount of acid in them. And that's normal because it helps us digest our food. It also helps keep some of the bacteria away from our foods. But some people, that acid can actually come back up into the esophagus. And that's when we have symptoms including heartburn, regurgitation, and some patients can even cause cough, chronic sinus problems. There's several different mechanisms for why reflux can happen. Most commonly, there can be increased acid production because of various foods that we're eating. There can be decreased tone of that sphincter, which is the muscle or valve protecting acid from coming back up into the esophagus. And finally, there's increased abdominal pressure. When there's increased pressure on that stomach, acid will naturally come back up into the esophagus. So we know that acid suppression is very important in keeping people from having these symptoms. And there's various different medications out there, including antacids, histamine blockers like Zantac, Pepcid, and then proton pump inhibitors, which are probably the most common forms of acid suppression that we have. But equally, if not more important, is our lifestyle, our dietary changes. Because we know a significant amount of, a portion of what we eat does contribute to this acidity. So taking step by step each of these mechanisms that I talked about, spicy foods, citric foods, such as orange juice, tomato juice, caffeine, alcohol, these all increase acidity in the stomach. And because of that, can cause more acid to come up into the esophagus and cause reflux. Fatty foods, fried, greasy meals, large meals, peppermint, chocolate, they actually decrease the sphincter tone, making that valve, that muscle much weaker, again causing acid to come up. And then obesity. Obesity increases abdominal pressure, again getting that acid back up. So these are all foods that we know cutting down or eliminating will actually help us improve our reflux. But interestingly enough, meaty diets actually meets all three of these criteria. Meaty diets or high meat content actually increases the acid production. We know that more acid is required to digest that meat, so more acid is being formed in the stomach. Furthermore, that meat, generally a high fat content, is going to decrease that sphincter tone, again, causing that valve to be open and cause acid to come back up into the esophagus. And finally, meat, more fat, more cholesterol, tends to cause more obesity, and you have that third component there, increased abdominal pressure, increased acid coming back up. So meaty diets actually are much more likely to cause reflux and acid problems. And we know that people who are eating meat are more likely to develop acid regurgitation. There was actually a study published just recently, in fact, about late last year, in a pretty popular journal called the Digestive Diseases and Sciences. They actually looked at Buddhist priests who are vegetarians and compared almost 150 of them to their age and sex-matched controls, meaning just the general community. almost a 10% higher increased rate of reflux in those patients who are eating meat. And that makes sense if you go back and look at the mechanisms and the way that meat actually contributes to more acid production. And we do know that acid over time can cause inflammation in the esophagus, can lead to a condition called Barrett's, and also in some patients, esophageal cancer. So very important to get that reflux under control, both through acid suppression and through lifestyle changes, a big part of which is cutting out the meat in the diet. So let's move on to gallstones. Gallstones are actually formed when cholesterol present in bile crystallizes. So we know that liver actually produces bile to help cut down or help digest the cholesterol that's being formed. And that bile eventually is stored in the gallbladder and released at the time that we're digesting food to help break down that fat, help absorb it. But bile can crystallize. And when it crystallizes, it can form stones, both in the gallbladder as well as in the bile ducts. Now, if you've known people who have had gallstones before, you know that it can cause very severe pain, nausea, vomiting. When those gallstones become infected, it can cause conditions called cholecystitis or cholangitis, which is infections of these gallstones, and sometimes even severe pancreatitis, which is inflammation of the pancreas. Patients who do have obstruction of their bile ducts, they can become jaundice, where they get yellowing of their eyes and skins because that bile is not being excreted normally in the intestines. So we know most gallstones are composed of cholesterol, the remainder of which are composed of bilirubin or pigment. And we know that cholesterol gallstones are most commonly seen in young women who are obese. So we use a mnemonic, fat, female, fertile. That's the way we remember that young women who are obese actually have a much higher rate of gallstone formation. We also know that gallstones are more common in the West. And the thought is that maybe diet related. We think that by preventing these gallstones, or by changing our diet and lifestyles, we can actually prevent these gallstones from forming. Number one, by increasing fiber, by decreasing fat, especially animal fat, and of course losing weight through diet, through exercise. Keeping that weight down actually helps prevent these cholesterol gallstones from forming. There was actually a classic article published in the 1980s in the British Medical Journal. And they actually looked at the effect of vegetarianism on the development of gallstones in women. They found that women who were non-vegetarians had twice as high likelihood of developing these gallstones than vegetarians. And interestingly enough, that risk was calculated after taking into account their age and their weight, or their obesity. So again, just supporting the fact that diet, animal fat particularly, does contribute to these gallstone formations and potentially could cause complications down the line. Let's move on to liver. So very common condition or common epidemic that we're seeing right now is obesity. With obesity also goes hand in hand liver disease, specifically something called fatty liver disease, or the medical term is NASH, or NAFLD. That's the accumulation of fat in the liver, and this fat over time can cause inflammation of the liver and eventually lead to scarring and liver failure called cirrhosis. And if you look at a spectrum, again, just initial fat being deposited, causing inflammation, and then eventually causing that scarring. In the United States, this NASH, or this NAFLD, is actually becoming one of the most common causes of liver failure, cirrhosis, and need for liver transplantation. So definitely a very common condition, and becoming, unfortunately, all too common, even in the pediatric population. So we know a diet high in fiber, low in fat, will help reduce the likelihood of fatty liver disease. Plant-based foods have only a small amount of cholesterol, so again, beneficial to preventing the progression or even development of fatty liver disease. Cirrhosis, which I mentioned, is scarring or liver failure, result of advanced liver disease. As I mentioned, fatty liver is one of the more common causes here in the United States. Other causes that you may hear of are alcohol, hepatitis B, hepatitis C. Regardless, though, the complications that you can develop from cirrhosis include hepatic encephalopathy, which is a very severe alteration of your mental status. People can become confused, even sometimes go into a coma, and various other complications as well. Specifically, however, talking about encephalopathy, liver failure caused by the accumulation of toxic substances in the blood. The liver actually functions as a detoxifying organ. So a lot of the chemicals that we are introduced to in our food are actually removed from the liver. But when that liver doesn't work or fails for various number of reasons, those toxins actually build up in the blood, including ammonia. You can see actually different pictures here in one of our classic anatomy books. Patients having dazed stares, having a flap called asterixis, being very aggressive, and in the later stage actually even going into coma. Sometimes patients can actually die if they have very severe encephalopathy. Plant-based diets, why that could be helpful in treating hepatic encephalopathy. Number one, they're full of vegetable proteins. And number two, they're high in fiber. Initially, it was thought that by restricting the total protein content in these patients could actually help treat encephalopathy, because we know that protein breakdown is what causes ammonia, causes that toxin substance. But a lot of these times, these patients are actually already malnourished. So if you limit their protein content, they actually may end up doing worse. So instead, the thought is to actually substitute that animal protein for vegetable protein. And adding the fiber in the diet also is beneficial. We know that vegetable protein has lower content of two chemicals or two substances called methionine and tryptophan, the metabolism of which actually results in neurotoxins. Those substances are found in much higher content in animal-based products than vegetable-based proteins. And again, substituting that for vegetable-based products can help decrease that toxicity, decrease the formation of those toxins in the body. And then high fiber diet. So high fiber, when it's digested by bacteria, actually helps produce substances that capture that ammonia, help it be excreted in the gut, excreted in the stool, keep it from building up in the blood. And then also clearance of that fiber by the bacteria helps clear some of that bacterial nitrogen waste products as well. So in addition to what we normally see in our diet, there are medications that we use for encephalopathy, laxatives, antibiotics, but a proper diet, including both vegetable proteins and high fiber, may actually be just as effective as the treatments that we have out there. And actually, my father has a good example, and I think he just stepped out, but he actually had a patient that he had treated many years ago for encephalopathy. The patient actually came into the hospital very severely confused, lethargic. They treated him with lactulose, which is a laxative that actually helps decrease the ammonia levels. He got better, and when he was discharged home, he was advised to stick to a very plant-based protein diet, avoid all the animal proteins, in addition to the medicines he was taking. So, he promised to do that, he promised to stay away from that, but, he ended up right back in the hospital about a week later. And so when my dad was talking to him and getting a history from him, he said, yeah, I've been taking my medicine, and just like you said, I've been avoiding all the meat, and all I've been eating is a lot of fish in my food, in my diet. So it goes to say that fish obviously is also included as part of that animal protein, and and that's literally all they found that caused that decompensation, or him to come back into the hospital with that encephalopathy. So let's talk about diverticulosis. Diverticulosis are pockets in the colon, predominantly formed in weakened areas over the colon. If you see the picture here, there are literally pouches that form, and they're often associated with constipation, not having enough fiber in the diet. Most of the time, diverticula don't cause any problems, but in some patients, they can actually cause severe bleeding, and in cases, severe inflammation called diverticulitis. Those patients, it can become very sick if they develop abscesses, which are pus pockets. So very important to actually prevent these diverticula from forming, or if they've already formed, from developing these complications. So you look at a picture through our camera, through our colonoscope. This is a normal, healthy colon. And these are those pockets, or diverticula. And in some patients, they can be very profound, literally huge pockets or huge diverticula. We know that incidence of diverticula does increase with age. About 50% of patients above the age of 80 will develop these diverticula. And we also know that it's a disease of the Western world, much more common in patients who are non-vegetarian. A very classic study that was done by Dr. Burkitt, who was a surgeon, was done in the 1970s. He actually took 1,000 patients who were South Africans who were on a vegetarian diet, and he did baromenemas. Baromenemas are x-rays, which they used to use in old days before they used colonoscopies. Interestingly enough, in these patients, he found no diverticula, no polyps, no cancer. Just pretty amazing if you think of it, just the incidence of diverticula and the rate of pathology. So again, being vegetarian, being on a high fiber diet does make a big difference. Actually, my dad did have another patient that he also saw. This patient actually had severe diverticulitis when he ended up in the hospital. In fact, so severe that the patient actually was being ready to be taken to surgery. But the patient had not tried any dietary or lifestyle changes. So my dad actually suggested, let's go ahead and try this on a fiber diet and see how he does. Maybe he won't need surgery, maybe he won't have the complications from surgery later on. Surgeon, however, was quite adamant, the patient's already gotten this far, he's not going to do well. And what his quote was is, the horse is already out of the barn. But nevertheless, he was willing to give it a try and see how the patient did. So the patient was put on a high fiber diet, cut down all the fat, the meats, and the patient never ended up in the hospital again. So again, very, very profound evidence just clinically that yes, fiber, vegetables, plant-based proteins do make a big difference. Finally, I wanted to go over colon cancer. It is my area of specialty, and it is unfortunately a very common cancer in the United States. In fact, it's currently the third most common cancer in the US and the second most common cause of cancer death. Females, we know lung cancer, breast cancer are very common, and males lung and prostate, but this is right after both of those. What this is a malignant or cancerous tumor which arises on the inner lining of the intestine. We know that the general pathology or cycle of these cancers are that they start off as a polyp or growth in the colon, kind of like this. And over time, those polyps can grow and can become cancerous, such as this picture here. So some symptoms that people can present with when they have cancer: bleeding in the stools, changing their bowel habits, feeling that they're not emptying properly, abdominal discomfort, any unexplained weight loss, and fatigue, because these patients, when they do have cancer, lose blood from the stools. They can become anemic, and that causes them to become weak and tired. But unfortunately, some patients may not have any symptoms at all and still have advanced disease, which is why it's very important to get screened for colon cancer, get checked even if you're not having symptoms. And national recommendations are to get started being screened at age 50. Now that recommendation changes if you have any family history of colon cancer, if you've had polyps before, or if you have other conditions that actually predispose you to develop cancer, including inflammatory bowel disease and certain polyp-forming conditions. But there are various different methods to be screened from cancer, including stool tests, x-rays, but by far the best test that we have is a colonoscopy. This colonoscopy actually allows us to go to the entire colon, and if we find any of those polyps, actually take them out at the same time, help prevent that cancer from forming. And the other benefit is if that's normal, we can go 10 years before getting a next colonoscopy, as opposed to these other tests, which have to be done much more frequent and may not be as accurate. You may have heard also there's a new test that's just got FDA approved, which is fecal DNA testing or stool DNA testing. Still in the experimental phases, actually has not been established as a test for screening at this point because number one, it's very costly and people don't know what interval to use that as, but something that you may hear about in the news. So this slide just kind of shows by age, number one, the incidence of colon cancer, and then incidence of polyp formation. So the key is basically this big jump between age 45 and 50, and then 50 and above. And then similarly, polyp formation, after age 50, about 1 in every 4 people, or 25% of the population, is going to develop polyps. So a much higher rate of colon cancer formation. So besides age, besides genetics, hereditary, we know that certain other lifestyle factors also can contribute to colon cancer. And a lot of times will ask me, well, doc, what do we do? How can we help, prevent this cancer from forming? So we know the lack of regular physical activity, a low fruit and vegetable intake, low fiber, high fat diet, especially animal fat, patients who are overweight and obese, and alcohol and tobacco use. All these things can contribute to polyp as well as colon cancer formation. So why is red meat more likely to cause colon cancer? Well, there's certain substances in the meat, especially in the processed meats, that actually can become very carcinogenic and toxic. We know that red meat has very high levels of specific type of iron called heme iron, which helps promote carcinogenesis or cancer formation because of the toxic chemicals that it forms. Similarly, processed meats contains nitrites and other substances that's when they're barbecued or subjected to high temperatures also can form carcinogens. And we now have an abundance of data that red meat, especially processed red meat, does increase the rate of colon cancer formation. So you can go through the various, probably previous 15, 20 years and find multiple articles, but I've just picked out 4 of these ones that are very prominent in terms of comparing the rate of colon cancer formation in vegetarians and vegans compared to non-vegetarians. First study is a diet and colon cancer study. This was actually published in a very famous journal, the New England Journal of Medicine, in 1990. They actually looked at almost 90,000 nurses aged 34 to 60. And of those patients, they actually followed them over time. And 150 of those patients developed colon cancer. They actually looked at their diet, their lifestyle, and compared those patients who developed the cancer with those they didn't. And interestingly enough, they found that those patients who developed the cancer had a much higher rate of animal fat intake. Specifically, those patients who actually ate meat were almost twice as likely to develop colon cancer. They took that a step further and they found that people who were eating meat every day versus once a month were almost 2.5 times as likely to get this cancer. But there was no association found vegetable fat or vegetarians and colon cancer formation. So very, very interesting data. You guys may have heard of the Loma Linda cancer study, very famous study that looked at 34,000 Seventh-day Adventists in California, and they actually followed them for 6 years. They looked at various different diseases, including blood pressure, cholesterol, heart disease. They found that the incidence was much lower in these patients, but specifically colon cancer. Once again, this number almost 2 times, 1.88 times as high rate of colon cancer formations in non-vegetarians compared to vegetarians. So a couple more studies, cancer prevention study, 148,000 adults, a little bit older population, 50 to 70. Almost 1,700 of these patients developed colon cancer. Same theme again, those patients who had a higher intake of meat, processed meat especially, developed cancer. And they actually found that there was cancer throughout the colon, either the early colon or proximal colon, and even rectal cancer. It didn't really matter. And this last study as well, the NOAC study, same thing. They looked at cancer actually in different parts of the colon, including rectal cancer, which is much more aggressive, much more likely to spread. 1.7 times as likely in those patients who are eating meat to develop this colon cancer. Now, an interesting study that was done, published more recently, actually combined all these studies. So it was a meta-analysis, and they specifically looked at the amount of intake and to see if that made any difference. And they actually found that patients who were consuming 50 grams of animal fat a day or processed red meat, their risk of colon cancer was almost 20% higher than those patients who were not eating. And if you increase that intake to 100 grams, the risk was 30% higher. So they actually found that colon cancer risk increases linearly with increasing amount of intake, up to about 140 grams a day. So again, very, very powerful data that we know over time. And there's several other studies that you can go through in journals and articles, and all with a common theme: animal fat, animal protein, much higher risk of colon cancer formation. So just kind of the last slide, which is actually probably the most important slide, is colon cancer. We know it's one of the most common causes of cancer and cancer-related death in the United States. But we also know that in addition to age and genetics, dietary factors play a very important role in developing colon cancer, especially red processed meats. And definitely get screened as recommended. Don't wait until any symptoms develop. So today we just talked about our bodies, digestive tracts specifically, and why they're suited for a plant-based diet rather than an animal-based diet, both anatomically, both physiologically. Why people who give up meat or don't eat meat, why you can have a good protein diet, intake of vitamins and minerals as needed, and overall your quality of life will improve off animal products and just on a plant-based diet. Any questions at all? We know for sure that it is the animal fat, the red meat content specifically. So whether or not dairy products or cheese could contribute it, we don't know, but probably less likely. Because it is, as I mentioned, those carcinogens that are in meat that are more likely to cause this cancer. Yes? Okay, so the question again, cholesterol inhibits the absorption. So I think what they may be referring to, and I haven't read that article, but that article may be referring to dietary cholesterol, which is a little bit different than what our bodies are normally making and all producing. Because vitamin D actually is inherently made from cholesterol. So that process, that enzymatic process in conversion of cholesterol to vitamin, using vitamin D, is actually dependent on sunshine. So whether there's a dietary intake different from the internal intake or what your body is normally synthesizing cholesterol, maybe that's a difference, I don't know. But if you have that article, I'll be happy to look at it and see what it shows. So the question was red meat specifically compared with fish or other. The data has definitely suggested that any kind of animal fat, including fish, is more likely to cause colon cancer. But specifically, we don't know for sure. I mean, there haven't been any specific clinical trials saying, does fish increase the risk of colon cancer? We do know for sure that red meats do. But by extrapolation, you can hypothesize that also fish or any other animal-based sources of protein can also have the same effect on colon cancer. I'll defer to my dad if he has any other thoughts on that.
If you compare red meat with fish, of course red meat is worse than fish, because red meat has a carcinogenic substance which will cause cancer, high blood pressure, high cholesterol level. If you are non-vegetarian, fish is better than red meat. On the other way, if you are vegetarian, which gives you all protein and everything, then why to eat fish in that sense?
Any other questions? Yes?
There are some nutritionists up at the University of Hawaii that are insistent that you cannot derive iron and absorb it from the vegetable sources, that you must eat meat. What is your response to that?
Oh, the question was some nutritionists from the University of Hawaii who insist that actually meat-based is the only way to really obtain iron in your diet or absorb iron in your diet, that plant-based sources don't have that. Definitely there's a different source of iron present in meat called heme iron. It's thought that heme iron is more easily absorbed in the body and that those iron levels are more easily absorbed. But either way, whether you get that source from a heme iron or non-heme iron, you're still absorbing that iron. So it doesn't really matter. We know for facts that vegans, plant-based, people who are eating plant-based diets, they do not inherently have iron deficiency or low iron levels. Otherwise, many of us here in the room would be all iron deficient. So again, the key is, in some people you may need that supplement, but you can obtain iron from plant-based sources. I would say that whatever they're suggesting is not true. Sure. So the question was regarding different levels of animal protein intake, vegans, vegetarians, lacto-vegetarians, and full meat eaters. And what the differences are, I guess overall in their health-wise. Plant-based sources, strict vegans, fruits, vegetables, grains, those are going to be truly your healthiest, most pure form of protein or intake. But me personally, and through the studies that I've done, I found that there's much more benefit to not eating meat, not eating these substances for those reasons that I discussed. Because overall health-wise, the less animal fat that you have, the better. Definitely the more meat you eat, the more likely you are going to have these problems. The more of it you can give up or you do give up, the less likely you are to have disease. Thank you all for coming out tonight and listening to my talk. If you have any other further questions, please feel free to come by and talk to me. Thank you.
Thank you, Dr. Ankur Jain, for giving us this wonderfully authoritative talk, particularly as it was based upon your own expertise and experience as a practicing gastroenterologist. I'd like to also thank his dad, Dr. Ahmed Jain. I'd like you to come back up to the podium. Thank you both, Dr. Jains, for giving us such great information tonight. And thank you all for coming. We have some great refreshments donated by the courtesy of Down to Earth. Mahalo to all of you for coming tonight, and have a safe return home. Good night, everyone. Thank you.
This program is brought to you by the Vegetarian Society of Hawaii, a nonprofit organization dedicated to sharing with the community the many benefits of a vegetarian diet. Free monthly meetings include vegetarian experts found locally and on the mainland, quick and easy cooking demonstrations, and healthful and delicious food samples. Members enjoy an informative quarterly newsletter, social activities, and discounts at many vegetarian-friendly restaurants and health food stores. For an application, call 944-8344. That's 944-8344. Or visit our website at www.vsh.org. vsh.org.